We're still moving forward towards phase 3. I'd like to be back up here on Monday with, an official announcement about phase 3. And so I'm trying to give a sense of what phase 3 will look like, and I'd like to go through a few topics now. I promised I would be back this week with an update around sports. Obviously, sports are, I think athletics are an important part of our life all the time. Good for our mental health, good for agility, teamwork, being with people, but especially so in summer. I know a lot of kids sleep in their Little League uniform the night before the first game, and it's a big part of what summer is. And so it's important to me, as your governor, as a mother, as someone who's played sports my whole life, to do everything I can to get kids back out safely. So to that end, I'm announcing the following updates for both youth and adult sports for phase 3. In phase 3, for youth and adult sports, we are going to be allowing no contact and low contact sports games to be played between stable groups with no limit on overall group size. So that's huge. That's great. Until now, we've said only scrimmages or drills and such. But once we get into phase 3, you'll be able to play in stable groups against teams with no limit on the overall group size. What does a stable group mean? A stable group means you have the same players and coaches together over the course of the summer. Same group of players and coaches together over the course of the summer. Why does that matter? That matters a lot. Because if somebody gets sick, we want to contain it to that stable group. No contact and low contact sports is baseball, softball, tennis, golf. Games can be played, once we go into phase 3, between teams within Rhode Island as well as outside of Rhode Island, provided that there is no stay-at-home order or other travel restrictions in the state that the other team comes from. In phase 3, we're also going to be allowing spectators at these games. However, we suggest that there's no more than 2 spectators per player, just an effort to keep the crowds down, and spectators are required to wear masks. We're encouraging players to wear masks when practical. Having said that, I recognize that that's often not practical, and so we're asking players to keep a 6-foot distance from one another, use common sense, avoid contact, do not go play if you are sick at all, and just keep a distance between yourself and your fellow players, and stay in that stable group. In phase 3, we are still discouraging close contact sports, so basketball, football, soccer, where you're in close contact. In those instances, youth or people should stick to practices, drills, scrimmages. You can do your football drills and such, but we don't want you playing games, close contact. I'm sure you're going to have more questions. On Monday, the details for youth and adult sports guidance for phase 3 will be posted at reopeningri.com. I will say that as we open phase 3, we're generally moving towards a place of giving you guidelines, recommendations, tools for how to comply. But I'm asking every parent of a child who plays sports, every coach, every athletic director who's involved in summer sports, I'm asking you to be responsible, be creative, and use your very best judgment so that we all stay safe. Last thing I'll say is, everything I just said pertains only to phase 3, which is summer, probably the month of July and maybe some of August. It does not pertain to 2021 school year for interscholastic sports. We'll be back out later in the summer with the new rules around how students can play once school starts up again. Anyway, I'm excited about that, and I know it's going to be this is a happy day for parents and kids who want to play summer sports. So once we enter phase 3, you can actually be playing games again, and it'll be more like regular summer sports. I also promised this week I would be back with an update on our beaches. Last weekend we had a very busy beach weekend. The weather was gorgeous. We did have some, it wasn't ideal. We have been limiting parking to 50% of capacity, and so as a result, last weekend we did find that we had to close the beaches early in the day, and folks waited in line. So on a hot day, that's no fun, and we want to do better. So this weekend, starting this weekend, we're going to be easing off of the parking restrictions at the beaches. We'll be increasing the parking to 75% of capacity, which is going to immediately add over 2,000 additional parking spaces, which is substantial. I also want to encourage visitors to buy beach passes online. We're going to make a bigger effort to have express lines, so if you have your beach pass, you go straight through. It'll also cut down on person-to-person interactions. You can do that by going online, beachparkingri.com. Now, I want to be very clear about this. As of this weekend, we are no longer selling seasons passes at the beaches. As of this weekend, we are not selling seasons passes at the beaches. So if you want a seasons pass, which I hope you do, you can go to beachparkingri.com. That way there, we cut down on the lines, the amount of time it takes in line, person-to-person interaction, and we hope that that will get you in and out more quickly. Okay, another bit of news on this front. By this weekend, we are also expecting to launch a new tool so you can check to see whether beach parking lots are full online before you show up and drive to the beach. I know a lot of folks drove to the beach only to find out they had to wait an hour or two before they could get in. So we're hoping that starting this Saturday, you'll be able to go to riparks.com/beachpass, and you can check on parking lot status of a particular beach at a particular time. We're going to be piloting that. Bear with us if there are some glitches this weekend, but I think that's going to help a lot. So you can go to riparks.com/beachpass and check out if there's a line at that beach. Now, this is all great because we'll have a better beach experience, but I want to remind you, no congregating in large crowds at the beaches. Please bring your mask, so if you have to go to the restroom or you want to go to the concession stand to buy something, or you run into people you know, I'd ask you to please wear your mask when you're next to people for more than 10 minutes, and if you have to go to the restroom or use the facilities or buy food at the pavilion. This is really, I'm putting my faith in the people of Rhode Island. We're opening the beaches more, we're making it a little easier for you, and we're counting on you to follow the rules. But I will say, if in the next 2 or 3 weekends we see no mask wearing at the pavilion, large groups of people bunching up, then I will, in a minute, go back to where we were, 50% capacity or less at the beaches. So let's get this right, let's have fun, and I hope you have a better experience at the beach than last weekend. I also want to talk about testing. So a few times I have been asked about the National Guard and how we're going to wind them down in our operation of COVID, and also how we're going to move our system of COVID response to a more stable place. Because the truth of the matter is, we're going to be living like this until there is a widely available vaccine, which could easily be a year or more. So a year from now, we're still going to be doing testing, still going to be doing contact tracing, and obviously the National Guard, I won't be relying on them as much as we are now. We'll be able to be out of a state of emergency, and so I'm trying to develop our systems to be in a place where we can be in a steady state. And today I want to talk about one step we're taking around testing to put testing into the community permanently and also begin the orderly process of weaning ourselves from the Rhode Island National Guard, who have been fantastic. As I said at the beginning, we are the only state in the country that has tested the equivalent of 20% of our population, and we are going to ramp up our testing. Testing is the key to figure out who's sick, isolate them. At the same time, we have to be integrated into the community. So with that said, this Saturday, June 27th, is going to be the last day of testing at the Twin River site in Lincoln, operated in partnership with CVS. We've been planning for this for a while. They're only now testing a few hundred people there a day. We've been slowly declining. We were at 1,000 a day. Now we're at a couple hundred a day. That was always meant to be temporary. And so this Saturday, June 27th, will be the last day of testing at Twin River. I will say there were some very dark days a few months ago when I didn't know how I was going to do this or how I was going to meet the needs of Rhode Islanders for testing. And CVS Health stepped up. I will forever be grateful to our local company, CVS, for stepping up when we needed them. We continue to partner with them, but between CVS and the National Guard, we set that up over a weekend, literally, to test 1,000 people a day rapidly, and it's been amazing, and I want to say thank you. Having said that, it was always meant to be temporary. They were tense. We had to close it down when it rained. It's been staffed fully by the Guard, so it's time to unwind it. And as you know, we're in a different place now. We are fully prepared for this. I want to assure everybody we've been preparing for it. Our testing demand runs well below our capacity at this point as a state. Even with the expansion of our asymptomatic testing program. So I don't want you to get nervous when I say we're closing Twin River. We could still test more people. We could close today and still have the capacity to test more people than are showing up to be tested. Particularly, we are moving in the direction, as Dr. Alexander Scott has said many times, we're moving in the direction of putting the testing right in the community, integrated into our public health system, integrated into our pharmacy system, integrated into our network of primary care providers, hospitals, and community health clinics. So we want it to be easier in your neighborhood. We are still partnering with CVS. You can still go to cvs.com and figure out where there's a close CVS testing site near you. CVS currently has 10 drive-through testing sites, which I've previously announced, which already more than offset the volume that's being done now at Twin River. So this is a change, and I want to just let everybody know. If you feel sick, you should call your doctor. Your doctor can get you to a test. If for whatever reason you can't or don't want to call your doctor, cvs.com, they'll ask you to put in your zip code, and you can go to the closest CVS near you and be tested. It's a drive-through program. I do want to say this, and this is important. The tests that we were doing at Twin River were the rapid tests. You would be swabbed and you'd know your results in 10 or 15 minutes. They were excellent, but as we know, a little bit less accurate than the tests that take a few days for you to get your results. If you go to a CVS drive-through, it will be the kind of a test which takes a few days for you to get your result. So I just want you to be aware of that and not surprised. Having said that, if you show up at a CVS drive-through because you feel sick, you need to be staying at home anyway until you get your results, which is another point I want to make. I want to say this again. If you are sick, you must stay home. If you feel sick, you have a fever, you have a headache, you have any kind of symptoms at all, you call your doctor, you go to a CVS site, you get swabbed, you have to stay home until you get your test results. As the doctor has explained, and as I have learned, people who are sick are fantastic spreaders of this disease. So it's vital that you stay home. Now, many of you are saying, yes, but Governor, if I stay home, I don't get paid. So I'm going to get tested and I'm going to go to work. So I want to remind employers that you must let your employees stay home if they are sick. In fact, you need to be screening your employees every day to make sure nobody is allowed to work who is sick. And these employees should be paid sick time. The federal government is guaranteeing 10 days of paid sick leave to workers who are employed in small businesses whose businesses otherwise don't provide sick time. That's in addition to the 5 days required by Rhode Island state law. Every Rhode Islander is allowed, granted 10 paid sick days. 5 from the state, 10 from the federal government. If you are sick, I need you to stay home. And you will be paid to stay home, sick. Also, unemployment insurance, if you have coronavirus and can't work because of it, you may be eligible for unemployment insurance, and I would encourage you to reach out to the Department of Labor and Training to see if you qualify. And finally, Rhode Island has temporary disability insurance, which you may also be eligible for if you have symptoms, which prevent you from working. You're too sick to work, or they prevent you from working, and you can also get in touch with Department of Labor and Training for that. So I do want to be very clear about this. If you are sick, you need to stay home. If you go get a test, you feel sick, you have to stay home until you know if you're negative. I also want to say we are still going to be using our Abbott machines. We have more than a dozen Abbott machines, and what we're going to use those for is rapid testing for nursing homes, outbreaks, places of communal living, when we have to get into a community like Central Falls, Pawtucket, Providence, homeless shelter. We're going to be using those rapid machines for a rapid response. Statewide, we have the capacity to run more than 5,000 tests a day, but on most days, we're running about just under 4,000. So if you take one thing away from this press conference, we need to test more people. We have capacity to test more. And I'd like you to consider getting tested. If you feel sick, you should get tested. Call your doctor and get tested. If you work in a close and contact business and you feel fine, I still am asking you to get tested. And we're working every day to make it a little easier and a little more comfortable. Different swabs for the nose to make it more comfortable. If you're a hairdresser, a waiter, a waitress, a member of the clergy, if you work at a gym, if you're a child care worker, if you're a bus driver, if you've been to a protest, if you've been to an event and you found yourself surrounded by a lot of people for more than 10 minutes and you just want to play it safe, go get tested. Please, we need more information to know who's sick, which communities have a high density of the virus, and so our greatest strength right now is testing and pinpointing and contact tracing, so we need to do more testing. And if you're hearing me say this and you're a waiter or a hairdresser and you're a little bit afraid, I'd ask you, please consider it. Do it as like your civic duty to Rhode Island. We all have to do our part, and this will help you, and keep Rhode Island safer. Finally, I want to give a quick shout out to my commerce team and the Rhode Island Tech Collective for helping us connect with employers to provide critical information about testing. In May, as we began to build our strategy for reopening the economy and getting our employees back to work, our testing team reached out to the Tech Collective to try to figure out a way to quickly get in touch with businesses to understand the businesses' plans for testing, reopening, and response. And in partnership with the Governor's Office and Commerce, the Tech Collective created the COVID Business Engagement Team, which is an amazing thing. It's a volunteer task force. These people, as part of the Tech Collective, have been volunteering to reach out to local business owners to provide businesses with testing information, and support. I want to thank you. Thank you to the Tech Collective for doing that. You've been instrumental in providing technical assistance for these companies so they can develop their outbreak response plans and their testing plans. And I want to encourage businesses to, if you haven't talked to the Tech Collective, if you haven't talked to Commerce about your outbreak plan and your testing plan, we need you to do that. If you're a restaurant and you don't have an outbreak plan, that's a problem. If you're any business, really, and you don't have an outbreak plan, you need to have one. We need to hear from you immediately if you have 2 or more employees who get sick. And so we've created a COVID business engagement team, and we'd like to see you use it. You can call us at 521-7805 or visit thetechcollective.org and ask about the business engagement team. All this will be on reopeningri.com. But if you're a small business out there, you have no idea how to develop an outbreak plan, and that's very likely, call us, we'll help you, and that way there, if something happens, we'll be ready to respond.